It can happen in seconds. Imagine this, you're sitting at the kitchen table. It's quiet. Your dad is across from you drinking his morning coffee. He reaches for the cup and suddenly drops it. You look up, his hand is shaking. His face isn't right. He tries to speak but the words don't come out. Just confused sounds. His smile is crooked. His eyes look scared. What do? Do you know what's happening? Do you recognize it? This is how stroke begins. It doesn't give you time. It doesn't knock first. And in this moment, whether you recognize it or not, that's the moment that decides everything. In this video, I'll explain how to recognize stroke in seconds, what actually happens inside the brain, what causes it, who's most at risk, how to prevent it, and how recovery really works from the inside out. Watch this video till the end, it might save your life or the life of someone you love. A stroke happens when the blood flow to the part of the brain is suddenly blocked or interrupted. Without oxygen and nutrients, brain cells begin to die, sometimes in just minutes. There are two main types of stroke. Ischemic, caused by a blockage or clot, it's about 85% of cases, and hemorrhagic, caused by bleeding into the brain. There is also something called a TIA, a mini stroke, where symptoms resolve within 24 hours, but it's still a warning sign that a real stroke might be coming. The consequences of stroke can be severe: paralysis, difficulty speaking or understanding, visual loss, memory problems, emotional swings, or even death. And even when people survive, many live with permanent disabilities. Let's look at the bigger picture. Every year, around 15 million people worldwide suffer a stroke. About 5 million die and another 5 million are left with permanent disability. Stroke is more common in low and middle income countries, where healthcare access is limited. But in Western countries, lifestyle factors like poor diet, stress and inactivity are pushing the numbers too. Most strokes happen after age 55, but younger people are not immune. Strokes in people under 45 are becoming more common, especially in those with untreated hypertension or undiagnosed heart rhythm issues. Men are more likely to have a stroke earlier in life, but women are more likely to die from one. Why? Because women tend to live longer, have strokes later, and often delay seeking help. There is one thing that determines how well someone recovers from a stroke: how fast they can get help. There is a simple way to recognize stroke symptoms. It's called FAST. F. Face. Ask them to smile. Is one side dropping? A. Arms. Ask them to raise both arms. Does one drift down? S. Speech. Ask them to say a sentence. Is their speech slurred or strange? T. Time. If any of these are present, call emergency services immediately. Other signs may include sudden loss of vision in one or both eyes, sudden dizziness, trouble walking or loss of balance, severe headache with no known cause, sudden confusion or trouble understanding speech. If you've ever seen this happen to someone, if you've ever lived through it, leave a comment below. Share your story so others can recognize what stroke really looks like. Your experience might save someone's brain. Now let's talk about why stroke happens. There are two groups of risk factors: modifiable and non-modifiable. Modifiable means you can change them. These include high blood pressure, the number one cause of stroke, smoking, diabetes, high cholesterol, obesity, physical inactivity, poor sleep, chronic stress, alcohol abuse, atrial fibrillation, and irregular heart rate. Non-modifiable risk factors are things you can change: age, sex, family history, ethnic background, prior stroke or TIA. But just because you can't change something doesn't mean you're powerless. Knowing you're at risk means you can act earlier, get checked more often and focus harder on things you can control. Back when I worked in the emergency department, we saw strokes almost every day. One moment I'll never forget. Two patients, both in their 60s, both had ischemic stroke in a similar brain region. One of them recovered quickly, the other barely spoke again. What was the difference? It wasn't the treatment. They both came on the same time. It wasn't their medication. It was their lifestyle before the stroke. The first man has spent his life reading, solving puzzles, writing journals, staying mentally sharp. The second man has been mostly passive, rarely challenged his brain. That was the difference. Neuroplasticity. The brain, when trained, has more roots to work around the damage. It can rewire itself, build new connections, and it fights harder when it has that reserve. You don't need to study neuroscience. Just engage with life. Read, think, reflect, question things, learn new skills. These habits don't just make you smarter. They help build a brain that's more resilient when life hits hard. If you want simple daily tips on how to maintain your brain health, follow me on Instagram. I share short science-backed content every week. Now, if you suspect a stroke, don't wait. Call emergency services immediately. Note the time the symptoms started, it affects treatment. Don't give food, drink or aspirin. Keep the person calm and lying flat with head slightly elevated. In ischemic stroke, a clot-busting drug called TPA can be given within 3 to 4.5 hours. In some cases, doctors can remove the clot mechanically, but only in the specialized centers and only if the person gets there on time. Every minute equals million of brain cells lost. Don't Google, don't check their blood sugar, don't hope it goes away. Call now. Recovery depends on the area of the brain affected, how fast help was given, and the person's overall health and motivation. But there is hope. The first days and weeks after a stroke are critical. That's when the brain is most adaptable, most open to repair. But recovery doesn't stop there. It continues for months and even years. Rehab may include physical therapy for walking and coordination, speech therapy for language and swallowing, cognitive therapy for memory and attention, psychological support. Depression is common after stroke. And above all, patience. Stroke recovery is a marathon, not a sprint. If this part of the video helped you understand what recovery actually looks like, click that like and let YouTube know this video matters. So, here what you can do now. Measure your blood pressure, know your baseline. Move your body, daily walks are enough to start. Quit smoking. Cut sugar and ultra-processed food. Limit alcohol. Sleep better. Manage stress. Even 5 minutes of deep breathing daily helps. Talk to your doctor if you have irregular heartbeat. Prevention isn't about fear, it's about freedom. Freedom to stay independent, freedom to live fully, and freedom not to become someone else's emergency. Strokes comes without warning, but now you know how to spot it. You know the risks, you know what to do, and you know how powerful early action can be. If you've made this far, thank you. And please share this video with one person who needs to hear this. Subscribe for more brain-centered videos. Real talk, real science, no fluff. And in the comments tell me, have you or someone you love experienced a stroke? What were the signs? Let's make this space helpful. You never know who you'll be helping.